And thanks for joining us here again. Welcome back. With the long Pioneer holiday weekend behind us, the push to vaccinate Utahns grows as COVID cases continue to surge across the state. Healthcare workers having an especially hard time as hospitals start to fill up with COVID patients. ABC4's Jillian Smuckler joining us live from Intermountain Healthcare in Murray. And Jillian, the burnout many frontline workers are feeling over a year into this pandemic is different this time around.
Emily, the stress of the pandemic hit healthcare workers hard, so much so that some of them ended up leaving the field altogether. But the difference between now and a few months ago is we have a readily available COVID-19 vaccine. But with more than half of Utahns unvaccinated, paired with some of the highest case counts we've seen in months, many are worried of what's to come.
We're bursting at the seams, and if we have more patients with COVID coming in, that's really going to stress us out.
Stress and burnout still plague those on the front lines.
It's been a rough 18 months.
Not only are they taking care of COVID patients,
we really haven't had a slowdown.
But they're having to do so with limited staff.
Some nurses have moved into other areas of healthcare. Some have left the profession. Some have gone back to school.
As the state continues to see more COVID-19 cases and hospitalizations, many are frustrated knowing this can be prevented.
I know that those patients with COVID that I have taken care of, they recognize now that the vaccine would have been an opportunity for them.
We have an answer to most of these concerns, and that's vaccination. But it relies on individual choice.
19 out of 29 counties have a very high rate, meaning there's over 200 cases reported in the past 14 days per 100,000 people. When you add lower than average vaccination rates into the mix, with a little more than 45% of Utahns fully vaccinated, some say the worst may not be behind us.
We remember what it was like when it was really bad, and I fear that we're heading there again.
Over the holiday weekend, the Utah Department of Health says our hospitalizations went up, with 343 Utahns in the hospital and 152 in the ICU. We also saw over 2,200 new cases since Thursday, pushing our 7-day rolling average to 646 cases per day, one of the highest counts we've seen in months.
It's not a good time for them to be going up.
With school just weeks away and kids 12 and younger still not eligible to get a vaccine,
I am worried about the kids going back to school with the vaccine not being available to them because they're not great at hand hygiene. They like to share things, including germs. I think it's a good idea to have kids masked.
Under Utah law, school districts can't require kids to wear masks. But even still,
we do recommend if you're not fully vaccinated, you wear a mask. The line between recommendations and requirements is sometimes very blurry.
And if you think just because you're younger, you're in the clear.
I can tell you from working the weekend, the patients we're seeing in the hospital are younger and healthier than the folks that we saw last spring.
And the Utah Department of Health says its COVID-19 guidance for schools should be finalized no later than August 1st. And of course, the moment that's released, we will let you know. Reporting live in Murray, Jillian Smuckler, ABC4 News.